Start by washing your hands, greeting the patient, and gaining consent for the procedure, ensuring a chaperone is present. Expose the patient to their underwear. Inspect the skin, looking at the hands for any tar staining or wasting of the small muscles. Look at the face for any xanthelasma or corneal arcus. Look at the abdomen for any obvious pulsatile mass, and look at the legs for any discoloration or shiny skin. Also looking for decreased hair growth in the upper and lower limbs, and checking the nails for onycholysis. Examine for ulcers, checking the malleoli and the pressure areas, especially between the toes, and then release. Normal reperfusion should occur over 2 to 3 seconds. Next, examine the pulses, checking the radial arteries, brachial arteries, carotid arteries, remembering to palpate them one at a time. Check for an abdominal aortic aneurysm. Check the femoral arteries at the mid-inguinal point. Palpate the popliteal arteries. The dorsalis pedis arteries. And the posterior tibial arteries behind the medial malleoli. Now perform Allen's test. This tests the ulnar and radial arterial supply to the hands. Occlude both arteries and ask the patient to open and close the hands several times. Once the palmar aspect of the hand becomes pale, test the radial artery by releasing it and looking for reperfusion, noting the time that this takes. This should be repeated for the ulnar artery. And also repeated on the contralateral hand. Now establish Berger's angle and perform Berger's test. Gently raise the leg, noting the angle at which the toes become pale. Once the toes become pale, swing the leg down over the side of the bed and look for a reactive hyperemia. This is a positive Berger's test, indicating peripheral arterial disease. This should then be repeated on the contralateral limb. Now auscultate for bruits, listening over the carotid arteries, the aorta, the iliac arteries, and the femoral arteries. Bruits are indicative of turbulent flow. Finally, complete your examination by recording the blood pressure and heart rate, calculate the ankle brachial pressure index, examine for varicose veins, perform a full cardiovascular examination, perform a full neurological examination, and order appropriate investigations, and finally thank the patient and help them dress.